Hello everyone, I'm Tim Beebe. I'm Interim Dean for the School of Public Health. In this episode of SPH Behind the Scenes, we're going to visit CHI, which is the Center on Healthy Aging and Innovation. We have a long-standing international reputation in aging in the School of Public Health. We established CHI in 2020 to broaden that and take it into new directions. I'm going to visit its director today, Joe Gogler, who is right down the hall from us. So Dr. Gogler holds the Robert L. Kane Endowed Chair for Long-Term Care and Aging. That endowed chair is named after the late Bob Kane, who is a long-time faculty member in the School of Public Health and a former dean of the school and a pioneer in the area of aging research and practice. The school owes a debt of gratitude to Dr. Kane for his work in the field, as well as his longtime partner, the late Dr. Rosalie Kane. Joe?
Hi, come on in.
How are you?
Good. How about you?
Good.
All right.
Good to see you. I brought your
this is what I need.
preferred drink.
Yes. More caffeine the better. So
I was going to get you a chai latte, but I thought that would be too hilarious.
yes, yeah. We don't want to be too can't have too much humor in the School of Public Health.
That is true. And so, thanks for doing this today.
Sure.
The purpose is to get a better understanding of all that CHI does, and but I just want to get to know you a little bit better and have other people know you better too. So, I saw that you went to Gus Davis Adolphus.
I did. Yes.
Are you from Minnesota?
Well, I grew up in Chicago until I was 15, and my dad worked for 3M, so he transferred here, and we've been here in Minnesota ever since.
So you did your graduate studies in Penn State.
I did.
What is the path you took back to Minnesota? What brought you back here?
Yeah, so after I got my PhD at Penn State, I actually did my postdoc here, an National Institute on Aging postdoc with Bob and Rosalie Kane. Then the opportunity came up with Dr. Kane's untimely passing in 2017 to assume the Robert L. Kane Endowed Chair, and I was very lucky and blessed to come into this position in 2018. It has a lot of significance to me, certainly professionally, for all that it entails and what it involves, and no one person can ever follow in the footsteps of Bob, I don't think.
The last word in the title of your center is innovation. So can you talk a little bit about how you're innovating in the aging and wellness state?
Much of the work is not necessarily directed by one person or individuals, but in a fashion that very much is truly co-creation with our robust external stakeholders, community organizations, the state, healthcare systems, the list goes on, and with our many faculty, students, and staff who are now part of CHI and interested in aging here at the university.
Talking about stakeholder engagement, shortly after you started in 2018, you set about a statewide tour hitting 87 counties to talk about long-term care and dementia and things of that nature. That's quite a feat. So what was the purpose of that, and what motivated you to do that? Because it's a big commitment.
One of the big light bulb moments for me is when I go out to these different communities, it also gives me the opportunity to see what are the resources available throughout the state. And I've been really surprised in terms of what communities are doing and what they're rallying around to help support people living with dementia. Sometimes people in their own communities don't know they exist. So it gives them an opportunity to connect with local resources as well.
Can you give me one example of a project or a study that's occupying a large portion of your time, like today?
A big initiative that we're doing is the BOLD Public Health Center of Excellence on Dementia Caregiving. This is a national center that I direct. The goal of this center, it's a CDC-funded effort. CDC, through what's called the BOLD Act, which was congressional legislation. BOLD stands for Building Our Largest Dementia Infrastructure. The goal of BOLD was really to develop public health infrastructure in dementia, to advance and engage public health agencies around the topic of dementia. Many states are very siloed in their approach to dementia. Oftentimes dementia is seen as an issue or concern of the Aging Service Network, which is funded in a very different way and approaches the issue of dementia in a very different way. I think what CDC and many of us are aiming to do is to elevate dementia as a true public health concern across the U.S. and across states and localities.
I know that Rajan Moon works in the ageism space. Can you direct me to where he is?
Sure. So he's in D330, and I believe I'm going to walk you over there now.
All right. Well, thanks so much for all that you do.
Sure.
Joe.
Thank you, Tim.
I appreciate it. And thank you for allowing me to drop about 10 pounds of water weight, given how hot you keep
it's
your
quite warm in
office
here. I wish I could control it. I don't. So. A lot of people involved in CHI who are also Indian. Looks really good.
Yeah, thanks.
Nice office. Well, thanks, Joe.
Thanks, Tim. Appreciate it.
Hi, Tim.
Hi,
How are you?
John. I'm
Good
well.
to see
Thanks.
you.
How are you?
Yeah, it's been a while.
Oh, it's nice and bright in here.
Yeah.
I was talking to Joel about all the large book of work in CHI.
Yeah.
And I understand that you've done a needs assessment among LGBTQ adults, older adults. Can you say more about that and what its purpose is and what you found?
Yeah, I'm very happy to have been part of this needs assessment that we did in partnership with Rainbow Health. It's funded by the Department of Human Services here in Minnesota. And it is the third in a series of needs assessments that started in 2002 and another one in 2012 and now 2022. So we have 3 snapshots in time to look at perhaps any changes that have occurred with LGBTQ older adults. There are questions related to their health, so asking them about their self-perceptions about health, asking about their family and supports, and then critical, there are questions about their experiences with service providers and their perceptions of service providers. So we get a better understanding of some of the fear and avoidance that LGBTQ older adults experience when perhaps in a very vulnerable state, they may have some chronic conditions or some healthcare issues that are causing them to seek out services, but this real fear of accessing services for how they may be treated by a provider. And I'm really excited to report that yesterday we received our official notification that the School of Public Health has been awarded an R01 NIH grant to continue a project that we were doing with Dr. Rossers in epidemiology and Dr. Shippey here on looking at the policies and the education of direct care staff in nursing homes and assisted living facilities in Minnesota as it relates to LGBTQ aging.
I saw that on Twitter, which is my main source of information, even from within my school. So congratulations on that important work. So I want to talk to Robin Fraser next, but I'm just kind of curious, and if you don't mind. Being a hockey player, I was interested in the origin of your first name.
Yes.
Can you say a little bit about that?
Absolutely. Well, you are probably one of the few people that I've ever spoken with that has known the origin of my name. So I am named after a French-Canadian hockey player, Réjean Houle, Montreal Canadien. And so I'm very excited that in my home office I have his hockey card signed by him. And I think we're the only 2 people that have this name.
Well, thanks for taking the time to meet with me, and thanks for all that you're doing.
Yeah, thanks so much, Tim.
Take care.
Yep.
And can you just point me?
Yep, I can walk you right over to Robin
right.
in our little suite here.
Yeah.
Robin's over here.
It is a sweet suite.
We do have a suite. And here's Robin.
Thanks. Hi, Robin.
Hi, how are you doing?
I'm well, thanks. How are you?
I am good. Good to see you. Yes.
You know, I'm learning a lot about what CHI does, and I know that part of your work is setting up structures for community engagement with the goal of enhancing equity in the system and among the aging population. Can you say a little bit more about the work that you do?
Yes, it's been a very exciting for us since the launch of CHI. One of the things that we were very intentional on doing is setting up so that our organization would be community facing. First and foremost is that we have a multi-ethnic, multiracial, multicultural community advisory board. And we didn't go with the people that are like the experts, in aging services and that are often on other teams. We really wanted to pull people that are grassroots, feet on the street, in the community, and that have relationships with the community organizations. And we've got a cab of about 23 people. And so what they've done in their first year is they went through a needs assessment. And so we had people work in their different cultural groups, and they identified, what are the needs of older adults in that cultural or ethnic community. And then they said, how are those needs being addressed? What are our assets? Are the needs being met? And then they moved to say, how could the university help support them? And so they've identified the areas that they want our support in, and are beginning now to move from planning to working on the initiatives that they want to work on.
That's fantastic work, and thanks so much for doing it. It's not easy, and I know that's a hallmark of a lot of our work. And
Yes.
and I know that Tatiana Shippey is working in that sort of engaged, a space trying to look forward equity in the care delivery
Right.
space. And so I'd like to meet with her next. Could you just kind of point me in her direction?
All right. She's
Well-
just out this door and around the corner.
All right. Well, it was so fantastic to talk to you and meet you in
Very
in
nice
person.
to meet you.
We're going to go see Tatiana Shippey, who is a faculty member in the School of Public Health. An interesting fact about Tatiana is in graduate school at Purdue University, she spent 2 years living in a long-term care facility where she got to know the people there and cultivate a strong understanding and empathy toward those who are in long-term care. And she utilizes that in all the work that she does. I've witnessed that firsthand in the work that we've done together, is that's kind of the fuel that drives her work. How are you? Good to see you. Good to see you. Yeah, so I've been talking to Joe and Rajan and Robin about the work that Chai does, and I'm interested in the work that you do in a couple areas. One is in the area of cultural, racial, and ethnic disparities in long-term care among aging populations. So can you tell us a little bit about your work in that space?
Yeah, definitely. I just completed in this April a large federally funded grant that aimed to address system-level racial disparities in residents' quality of life for people who use long-term care. That work was one of my passion projects, and I am so pleased to see that the results of that work are starting to be disseminated now. We've had great engagement from community organizations as well as national organizations. So we're disseminating that work and continuing now to advance that work, moving toward policy change. And in that same vein, I am also now looking at racial and ethnic disparities in other settings. So that work focused on nursing homes, but we certainly know that due to systemic racism, we see pervasive racial disparities across all of long-term services and supports. So I'm leading another large federally funded project that's looking to improve quality outcomes for people who are on Medicaid, so they're already vulnerable, who use home and community-based services, to develop measures of quality for those services, standardize them across states, and also understand if the unmet needs vary by for people who live with dementia, because I know that's also a growing, large, and important group.
Right. So again, it's amazing work, and it's the manner in how you do your work is also amazing too. You really are engaged the community, you engage other stakeholders. How did you come upon that as kind of your style of engaging, and kind of also think about you also on the back end too. You don't rest at the publication. You meet with the legislatures and society. How did you kind of establish that style of engagement and dissemination?
When I think about what drives me in the morning, why do you want to come to work? And, this is demanding work, but it's also highly satisfying work. Because ultimately, while I want to publish in peer-reviewed journals, that's how we generate evidence, it's just a small piece of what we do. I want to change policy. In the end, I want to improve outcomes for people who are most vulnerable in our society, which in my focus are older adults who come from minoritized communities, including people who are sexual and gender minorities, who don't have their voice heard.
Well, thank you so much, Tatiana, for all that you do and for taking the time today
So glad you could
to
come
do
by.
this video. I hope you have a great day and hope you're well. Hope you're enjoying what's left of this summer.
Thank you. Nice to see you, Tim.
Nice to see you.
Take care.
Have a great day.
You too. Bye.
Well, there you have a snapshot of the people involved with and the work undertaken by CHI. You know, if we're lucky, we are all aging in this world. It's good to know that CHI is working to make our experience better, our lives fuller, and I'm so happy to be part of a school that has a CHI in it. So stay tuned for our next episode of SPH Behind the Scenes. I'll see you then.